healing system like as a hospitality, we'll find many different mentality. Some people will come which are very angry. Okay? Some person will come they are very soft and sweet, want to hug you like this all. How many face you will change within the one day? Right? If someone is coming, will have hi, how are you? Then again some person is coming, I have any still pain. Then you are sad. Some person will start to crying, then you will go, oh my God, everything is normal. No, you are, because what reactions you are giving, trust me, this is true. If you want to see the practical case, Preet is one of the good example for this. When Preet, our student, yoga student, when she came here, she practiced with me maximum more than 2 years, continued non-stop every day. If she is treating to any patient, she is getting the same symptom at night time.
Why?
Yeah.
Okay. Yeah. So if you are more emotionally attached with patients, no,
You get
you will get that one. So one of the very good doctor, he wrote one book now in 2011, and he mentions first time and all people become like, oh no, this is not true, and he gives a very good example. He sent a message that disease is not comes from the genetic, the disease is comes from environmental. Okay, because your DNA filter the millions time. If the dirty water, if you filter 10 times that water you can drink. Okay, so your DNA is filtering the millions time. How the disease can come with your genetic? He says what you have the environmental issues. For example, if he is my father, my son, please give me the diabetes tablet. Oh my God, this is 11 o'clock. I have to take diabetes tablet. Can you give me diabetes? My cell want to experience what is that benefit and how that is reacting and what is the diabetes. Understand?
So you're responding to that, not genetics.
Yeah. And then we are not saying like all of the case, but he said maximum amount of the case. Then he did research because he know if I publish this one, then many people will come against me. Before publish his book, he researched on the hostel in the colleges. If some girls having the like menstrual cycle issues and who is living with that girl, oh my God, she is suffering, and all that expand to all the classmates. Now they having the issues. And who was little bit more esteemed? If you have issues, why you are not going to the doctor? And she is not suffering. Who is more attached? Who is more emotional? They having their body attract very easily because I want to experience your pain.
Because energy travels.
Okay. So when we'll come on the aura, that time we will understand our aura, which is it's called the cosmic energy, is not inside the body. It's the surface of the body. How pure you are, your body will go. That will expand that much. Okay, and if I am coming here next to you and your aura is like this, my aura and your aura, there are many videos they publish like this, how the energy is affecting, how the energy, I come here, you come here, and my cosmic energy is collecting your informations. Unconsciously, we don't know about that. My information is collecting your energy. Now I want to go more deep. I want to become the more emotional for your disease. Then lots of the problem is coming to you. After 1-2%, are you having headache, migraine, this and that, and all issues coming.
So Preeti would react that way.
Yeah, whenever he's coming, he's hugging it. Oh my God, what happened? And they are saying this story, that this story I had that. Everyone having the problems.
Right.
Everyone having the problem. Just be like it. Okay, what's the next? Yeah, please give them good questions. Always trying to listen good. I'm not saying like if they are sharing something to block them. No. We listen them very carefully. We'll give through their all subject. We'll give some questions. Okay, what happened next time? So after that, what you did? Have you tried any other therapies? This. What was your experience after that? You are just professional. For this is my only case, for my practical. This is not my problem, this is not my emotions. Okay? And always be like that. Then right there. And one more book he mentions, he researched on the whole field of the doctor. And he said the maximum amount of the psychologists in the age of the all they die due to psychological conditions. All the cardiologists they die due to cardiac arrest. All the diabetologists they die due to diabetes. And this is very true. I observe in my practical experience the people having these issues. And healthy person is general physician. He mentioned the healthy person is general physician because one day is diabetic case, one day another case, second day another case, one day fever, one day is cold and cough. Because what we are hearing every day when we come on the sound therapy and Sabda therapy, what we pronounce, the resonance comes from the organ, and each and every resonance stimulate our cell, our organ. So what you pronounce more, that organ become the more that much activate or the imbalance. Okay? So always, my teacher was a little rude. He was like 92-year-old. He was a little bit rude always. He was treating like this. But time is changed. If we become that much rude, so maybe no one will come.
Yeah.
But little bit of the balancing life is very good. And the maximum amount of the year, the lots of the allopathic doctor, MD, they were in the line to take the medicine from him. Go in the line. Stand there. Okay. No problems. Okay.
He has already got a reputation.
So yeah, if you have good skills, then your personality, way of the talking, way of walking, that is the more importance than people. For example, I had many cases which I'm not getting good results from last month of the month or year maybe, but still they have a good faith. He will fix us.
Yeah.
He will fix us.
Because they have the faith and they're not receptive about it.
Hmm?
Is it because of that?
Environment affects too much. Okay, environment. Many my patients when they are talking, I don't have that much emotion. I not go and cry and do this. So okay, I listen. So in the medical line, they used to teach try to listen to patients minimum at least 5-8 minutes, because you are like, okay, what the problems do you have? Okay, we'll do. Okay, so if you are not giving little bit time, the patient will say, okay, maybe he will not understand my care, how he will treat. If someone say, I have the knee problems, okay, I'll go and start needling. No, give little bit time. Try to give them that feeling. I want to know more about that. When this happened, since how long? Then this. What was your first experience when it happened the first time? It was on the medial side or lateral side. Have you done any X-ray or MRI? Any medicines, history, this and that and this all. Okay? Then you are going to check. After this all informations, explain them just for 2 minutes. Okay? So this is the meniscus problems. Meniscus is tear, and vastus medialis is your little bit of the weak. Okay, this and that. So we are going to treat now these ones and going to do it like this. So bring the more collagen fascia, will heal that fast. Only this. Can we start the treatment? This is the little bit professional way. They said in just starting needle, they are first time they don't know what is this. Explain them what is the problems, what you understand. Okay, you can call your some of your colleague in like a senior or maybe some. Okay, so can you come? So can we do a little bit diagnosis? That is a professional way. They don't mind, because many doctors they refer to another doctor. They call friend of the patient. This is the one of the case, and I don't understand this. Can you help me? Friend of the patient, they are asking to another doctor. So the patient will not think if you don't know how you will treat. Because there are many things in the human body. No one understands the whole body. Understand?
Yeah, absolutely.
In the Mumbai also, when I start my clinic, it was the inside there. Have you visited in Mahavir Nagar? Never. Okay. Inside the wall, like end of the next to bathroom. If some patient is coming, we have to send one person to bring the patient inside. Otherwise, he will not find the place. And there was no single board. And the range of the patients every day 20, 25, 30. And charges like 20 package, 20 sittings like 1 lakh rupees, 1 lakh rupees. I was working with someone. Okay, so like this, there is no advertisement. Everything is comes from word of mouth. If you have the proper skill with the needling and treatment, so our environment is matter too much. This I believe myself. I understand that. Okay, so that's the always, because you have 1 month now. You know, if you once make your habit here, this and
Stay
that, and then when you will open your clinic, you have that skills. You don't need to change anything. You don't need to make your habit new habits. Just everything like this. Okay, do not talk anything false which is not truth. Okay, sometimes little bit false is good. I fix like that, so they give the confidence. Okay, you don't understand the case and you are talking anything. When the patient will come next time, now you understand the case, but now you have to explain something else. Yesterday you explained something else. Now you are explaining something else. Patient confused. Okay, as per me right now, what I found that is these. We'll do one sessions. You will find the good results. We'll continue. Otherwise, we'll test tomorrow again. Many patients, how many sessions it will take? I never ever give any time period. I'll say we'll do 1-2 session. Let's see how fast your body is responding. Okay, if your body responds within 1-2 sessions, then no need many sessions. Okay, if your body is not responding, then we can try only. But at least in 1-2 sessions, you will find your way, is it good or not. Okay, and always try to explain little bit about the acupuncture, how it's working. Okay, so this information will give you more clarity. Okay, and always work little slow, because I have this very bad habit, because it comes when course is not going on. I am alone, sometimes 1 or 2 students, and there are many patients. So I have to walk and go fast. This is a very bad habit. Okay, so and do not listen patients more than 8-10 minutes. When you are listening too much, no, then they are talking, they are repeating same thing from different way many times. That's irritating. Okay, not just first time they will explain, and second time they are going to explain again and again. Some patients having that habit. Okay, for example, I have an auntie. I explain each and every session. She will ask the same question next times. Okay, so doctor, I have this issue. I said I have the book. So I have that your diagnosis sheet. I know everything. How are you feeling after the last sessions? Before starting next session, we ask only questions. How are you feeling after the last session? Is there anything changes? If increase or decrease, don't ask the only positive. Okay? If there is anything increase,
Could be worse.
or the decrease, because when we are targeting the patient feeling good, no patient become like this. Why is forcing me? We know only, we want to know only truth. Okay, how are you feeling? Yeah, it was one day very good. The next day pain is shoot up. That's good diagnosis. Sometimes patients are little bit like masochist. Masochist, you know, it with high vata, high energy. Oh my God, I feel very good. This and that. They feel this much benefit and explaining this much. Try to balance your emotion that time. Okay, so in the medical field they used to teach like this. If the very good result, don't become the more excited. In excitement you do lots of the mistakes. Okay, and if the case is not good, don't be sad. You don't know how many doctor he visited and then came to you. You are not first doctor. Many MD and PhD doctor tried everything, but there is no result. So do not expect anything from the patients. For you, this is just research. Do your best what you know. Okay, but do not expect anything. Okay, when you expect, you die 2 times. One, you doing the expectations. Second, the expectation not become the truth. Okay, so for you, this is the case. Do your best. What we know, just do your best. If you are doing your best, you will get the result. If you are not doing best, if you are expecting, oh my God, this is the very good hero, I'll do the treatment, good, you do good advertisement, this is your expectation, and exactly opposite thing will happen. Okay, you don't give that much of the importance and that much of all things. Just do your best. Okay, this is the case. That is the case. I meet most of the all Bollywood actors and actresses. But if you check my old profile, I have not seen a selfie or picture with them. I never ever click one selfie with anyone. because that is disrespect for our center. If someone goes, "Okay, sir, can you please?" He came to you. You have the more value, right? When we'll go out and if you are clean selfie, we meet in one bar. That's the normal thing. That's not your place. In the clinic, you are the professional. Focus only on that. Outside the clinic, what you do, don't mind. You are going with your partner, you are smoking, you are drinking, that's your personal life. Even if someone is commenting on your that life, that's bullshit. Don't focus on that. But in the clinic, okay, I'm not talking about here. If you do anything here, after 1 month you will go. I can balance that clinic after 15 days. Okay, the patient, I can make that flow again after the 15 days. But this is very good for you because I have the history. All my students who learn here, around like 75 to 80% right now, they are running their own clinic. Each and every my student, they are practicing their own clinic or maybe home visit or acupuncture. No one is a student like this. After this, they forget. I just remember only one student now. He's not practicing. Okay? So this will be very good. Not for the clinic, maybe for your self-treatment, for your family. And one day will comes when you realize maybe healing system is one of the part of our life. So when we'll remove this needle, no?